Well, we presented a study at the ESC Congress looking into the outcome of in-hospital outcome for patients with severe PAD undergoing peripheral intervention, but in the presence of end-stage kidney disease. As you know, there is more than 8 million patients presented for severe PAD in the US and more than 200 worldwide. 10 to 40% of patients with end-stage kidney disease have severe PAD requiring intervention. So that's a big burden for patients with end-stage kidney disease. So we specifically looked into their outcome. We have three main endpoints. Number one was the in-hospital mortality. Number two is major adverse cardiac events and also bleeding and vascular complication. When you look into the demographic, they were comparable. Average age was 62, 63 in age. And in terms of comorbidity, there was more heart failure, more CAD, more PCI, and the end-stage kidney disease. Interestingly, the mortality of patients with end-stage kidney disease undergoing PVI or peripheral intervention was higher with an odd ratio of 1.3. So that indicates that the burden of end-stage kidney disease by itself, after adjusting to multiple covariates, was still significant and showing a high mortality for in-hospital mortality. Number one, we have to stratify patients coming to the cath lab for peripheral interventions. That include also especially patients with end-stage kidney disease. We have to really stratify them, make sure their comorbidity is controlled, diabetes, hypertension, anticoagulation. So we are selectively taking patients to the cath lab when they are completely optimized. And number two is, which is ideal, is to prevent end-stage kidney disease by again practicing secondary intervention of controlling diabetes and hypertension and make sure these patients are on tight diet control and medication control before they present late, unfortunately, with end-stage kidney disease. Highlights are a lot, but one big thing is for me and related to my practice is the shock culprits trial. And this is a very key study and the findings are very clinically relevant. And we practice this every day. And the results of the trial are really going to help us practice and support our practice of treating only the culprit vessel and not to and stage the rest of the vessel if there is any other coronary disease.